हाइपोथायरॉयडिज्म आज डिस्कस करेंगे मेडिसिन की बुक से। डेविडसन की बुक हम कर रहे हैं फॉर मेडिसिन एंड टुडे विल ट्राई टू कवर another aspect of endocrine medicine which is related to thyroid gland. Thyrotoxicosis we have already done and I told you in the beginning video जब हम thyroid की medicine start कर रहे थे कि thyroid के पेशेंट की प्रेजेंटेशन तीन मेजर तरह से होती है. वन ऑफ देम वाज हाइपरथायरॉयडिज्म व्हिच वी हैव डन नाउ एंड द सेकंड वन दैट वी विल डिस्कस टुडे इज हाइपोथायरॉयडिज्म. सो दिस इज आल्सो वेरी कॉमन कंडीशन बाय व्हिच द पेशेंट्स प्रेजेंट टू द क्लिनिक. Hypothyroidism is a common condition, that's the first line you see, but autoimmune disease such as Hashimoto and thyroid failure following radioactive iodine or surgical treatment of thyrotoxicosis account for over 90% of the cases. So this is a super important line. यानी जरा समझें इस बात को कि थायराइड ग्लैंड हाइपो काम तब करेगा, हाइपो यानी इट विल फंक्शन लेस. 90% ऑफ द कॉजेज इन चीज़ों का कॉम्बिनेशन है. सो आइदर देयर इज एन ऑटो इम्यून प्रॉब्लम because of which the thyroid is not working, or there is radio ablation or surgical treatment. यानी patient initially आया था with complaints of hyperthyroidism, you treated it, thyroid काट लिया आपने और बाकी जो बचा हुआ thyroid है वो shut down है और काम नहीं कर रहा. So this is then known as the hypothyroidism because of treatment of hyperthyroidism. So पहले problem hyperthyroidism का था, now it's not working because काफी सारा exercise कर दिया है system. Women are affected approximately 6 times more commonly as compared to men. So women, all beautiful women out there, you are at more risk. How do you assess these patients clinically? The clinical presentation of hypothyroidism usually depends on duration and severity of hypothyroidism. यानी कितने अरसे से है और कितना severe है. यानी if it is only 5% of the thyroid which is not working, if it is 10% or 80% or what. Those in whom complete thyroid failure has developed insidiously over months or years may present many of the clinical features listed in the box. अब ये बॉक्स हम थोड़ी देर में देखते हैं. और कुछ ऐसे होंगे जिनमें बहुत ही माइल्ड किस्म का हाइपोथायरॉयडिज्म होगा, मेजर सिम्टम्स होंगे ही नहीं. सो लेट्स हैव अ लुक एट box 18.7 so that we have an idea what we are talking about. Okay, so if you look at this one, this bit, thyrotoxicosis, we covered last time in the previous video. Today we are going to focus on hypothyroidism. So and these are very much, in most instances you will see that the signs are opposite to what we see in thyrotoxicosis. So obviously when thyroid gland is secreting more thyroid hormones versus when thyroid gland is secreting less thyroid hormones. Okay, so in thyrotoxicosis we talked about weight loss. In hypothyroidism there is weight gain. In thyrotoxicosis there was heat intolerance, now it's cold intolerance, सर्दी बर्दाश्त नहीं होती, fatigue, थक जाते हैं, dry skin, dry hair, menorrhagia, menstrual problems, and weight gain is an obvious one. And these are the most common signs and symptoms associated with hypothyroidism, but then there are so many others. So hoarse voice, for example, anemia, carotenemia. So there's a long list, same as there was a long list also in thyrotoxicosis, but must remember would be obviously the most common signs and symptoms, because if you miss these most common ones, then you miss the patient basically. Okay, right, so let's carry forward our discussion. After hypothyroidism के बिल्कुल basic concepts, we are now talking about the clinical assessment, and we also have to spend some time understanding कि management कैसे होती है, but that comes later on. अभी हम ज़रा उसके ये देख लें कि पेशेंट आपने पिक कैसे करना है. तो यहाँ अब वो सारे जो ऊपर सिम्टम्स हमने देखे थे, साइन सिम्टम्स देखें, लो पिच होर्सनेस ऑफ वॉइस, पुअर हियरिंग, स्लर्ड स्पीच, ये सारे कार्पल टनल सिंड्रोम, दे कैन ऑल बी इंडिकेटर्स ऑफ हाइपोथायरॉयडिज्म. Infiltration of dermis give rise to non-pitting edema, which is then known as mixed edema. This is also common, and actually it is most marked in the skin of hands, feet, and eyelids. Hypothyroidism के indicators हैं ये सारे. The resultant periorbital puffiness is often striking, and it is something which you cannot miss, and may be combined with facial pallor due to anemia. So you see they are building a picture for hypothyroid patient to you. Most cases of hypothyroidism are not clinically obvious, however, and a high index of suspicion needs to be maintained so that the diagnosis is not overlooked. So very important. Patient अगर simple इतना भी मेरे पास क्लिनिक में कहता हुआ आ रहा है कि डॉक्टर साहब मैं बहुत थका थका रहता हूँ, I would always consider thyroid profile. Okay. The key discriminating features in the history and examination are highlighted in figure 18.6. अभी देखते हैं इस figure को, important है. Care must be taken to identify patients with transient hypothyroidism in whom lifelong levothyroxine therapy is inappropriate. So transient is something which comes and goes. So ये ना हो कि patient में transient hypothyroidism और आप पूरी जिंदगी के लिए उसको thyroid hormones दे रहे हैं. So that you have to identify if it's transient or permanent hypothyroidism. This is often observed, transition hypothyroidism की बात हो रही है, during the first 6 months of thyroidectomy. यानी अगर आप किसी पेशेंट का किसी भी वजह से थायरॉइड ग्लैंड रिमूव करते हैं तो इनिशियल 6 months में what happens is उस पेशेंट का थायरॉइड प्रोफाइल लो हो जाता है. ओके, सो दिस इज समथिंग दैट यू हैव टू कंसीडर. तो सर्जरी के बाद 4-6 महीने तक आप थायरॉयड हार्मोन देते हैं पेशेंट को, लेकिन उसके बाद जो पेशेंट का बचा कुचा ग्लैंड है वो ठीक से काम करने लगता है तो हाइपोथायरॉयडिज्म की कंडीशन खत्म हो जाती है. ऐसे हाइपोथायरॉयडिज्म को हम कहते हैं ट्रांजिएंट हाइपोथायरॉयडिज्म, जो थोड़े अरसे के लिए था. तो इसीलिए आपको ट्रीटमेंट भी थोड़े अरसे के लिए करनी है. ओके, नाउ लेट्स हैव अ लुक एट फिगर 18.6 बिकॉज दैट इज एन इम्पॉर्टेंट एल्गोरिथम जिसमें एक्चुअली हाइपो और हाइपर दोनों बताए हुए हैं. सो दिस वन इज an approach to adults if they have suspected primary hypothyroidism. ठीक है? So if we talk about primary hypothyroidism, the things will start from low levels of T4, and if it is primary, which means the problem is within the thyroid gland, तो T4 levels obviously कम हैं, तो higher center से from the hypothalamic pituitary axis there will be more TSH. So that's a classical picture in the blood of patients who have primary hypothyroidism. So low T4 and high TSH. Okay, so and then there are so many different ways to move forward the yes and no bars you have to see. So there are different scenarios and different causes, and then so for example I'll take you through some of them. So if you look at the TSH value, it's high, lekin if the higher side is more than 20 international units per liter, then so if it's more than 20, okay, then what are the things that you have to consider? It's more than 20, this simply means it's very, very high. Now, is there any history or are there any signs of transient thyroiditis, inflammation, यानी कि neck pain वगैरह है, या less than 12 months postpartum patient है इस वक्त, यानी 12 महीने पिछले 1 साल के अंदर अंदर डिलीवरी हुई है, थायरोटॉक्सिकोसिस के कोई सिम्टम्स तो नहीं थे, लेस देन 6 months सिंस थायरॉयडेक्टमी, अगर ये सारी चीज़ें हैं तो पता है आपको ये क्या इंडिकेट कर रही हैं? दीज आर ऑल इंडिकेटिंग कि इस पेशेंट का जो हाइपोथायरॉयडिज्म है दैट इज ट्रांजिएंट, ये इनकी वजह से है या डिलीवरी की वजह से है या थायरॉयड की सर्जरी की वजह से है. सो ऐसे पेशेंट्स में यू विल गेट टेम्पररी रिप्लेसमेंट ऑफ T4. आप सिर्फ टेम्पररी रिप्लेसमेंट देंगे because this is transient. लेकिन अगर ये सिनेरियो आप चेंज कर दें कि there is like permanent issue, permanent मसला है, तो obviously you go towards permanent. So that's I just told you how to read the algorithm. Okay, so spend some time over the algorithm, and if you have any issues, let me know. And we will continuously be coming back to this diagram anyways throughout the chapter. Now, how do you investigate hypothyroidism? In vast majority of cases, hypothyroidism results from an intrinsic disorder of the thyroid gland. This is what we call the primary hypothyroidism. In this situation, T4 level is low and TSH level is high, usually in excess of 20 micro-international units. Measurement of T3 are unhelpful since they do not discriminate reliably between euthyroidism and hypo. So T4 is the value to look at, okay? T4 की value देखें और TSH की value देखें. That's very important point. Other already you start feeling like a doctor है ना, कि कौन से टेस्ट देखने हैं, टेस्ट की वैल्यूज क्या होंगी. अदर नॉन स्पेसिफिक एबनॉर्मैलिटीज, आपको और भी कुछ करने पड़ेंगे टेस्ट, सिर्फ T3 T4 नहीं है. यू हैव टू लुक एट द ECG पैटर्न, T वेव एबनॉर्मैलिटीज तो नहीं है. इनफैक्ट यू ऑल्सो हैव टू डू सम अदर ब्लड टेस्ट, फॉर एग्जाम्पल ऑटो एंटीबॉडीज चेक कर सकते हैं, एंड सो मेनी अदर थिंग्स. हाउ डू यू मैनेज द पेशेंट? ट्रीटमेंट इज लेवोथायरोक्सिन because thyroid glands के hormones are in lower concentration, so you give these hormones therapeutically. अब कितने अरसे के लिए देना है, that's important. If it's transient, you will treat the person only for some time, obviously. It is customary to start with a low dose of 50 microgram per day for 3 weeks, increasing thereafter 100 micrograms per day for a further 3 weeks, and finally the maintenance dose is 100 to 150 micrograms per day. So you see how there is a staggered approach. In younger patients, it is safe to initiate levothyroxine directly at a higher dose. I usually do it, staircase approach. के पहले थोड़ा फिर एक maintenance dose. Levothyroxine has a half-life of about 7 days, so it should always be taken as a single daily dose, and at least 6 weeks should pass before repeating the thyroid function test. Because आप exogenous thyroid, दे रहे हैं, levothyroxine आप दे रहे हैं, so it will lead to false, TFTs, thyroid function test. So you have to wait for some time, because the last dose आपने दिया होगा उसको completely body से disappear होना है. So you have to wait for some time, at least 6 weeks, so that you can repeat the thyroid function test. Okay. अगर reduction in weight and periorbital puffiness occur quickly, but the restoration, अच्छा ये बता रहे हैं कि ट्रीटमेंट के बाद weight settle हो जाता है और periorbital edema settle हो जाता है, लेकिन skin changes में time लगता है, about 6 months, sometimes maybe more than that. The dose of levothyroxine should be adjusted to maintain serum TSH within the reference range. So that is the main thing जो आपको देखना है, यानी ट्रीटमेंट मॉनिटरिंग के लिए कौन सा पैरामीटर इंपॉर्टेंट है, TSH. ठीक है. So ये मैनेजमेंट से एसोसिएटेड बड़े इंपॉर्टेंट पॉइंट्स है सारे बॉस. Some patients remain symptomatic despite normalization of TSH. यानी आपको बायोकेमिकल प्रोफाइल में TSH is looking absolutely normal, but they are clinically not fine. So maybe you have to consider giving some more levothyroxine to these patients. You obviously decide treatment case to case basis per. It is important to measure thyroid function every 1 to 2 years once levothyroxine therapy has been established to see how things are going within the body. This encourages adherence to the therapy, and obviously patient feels well if the TSH levels and T4, T3 levels, they are all okay. Some patients have persistent elevation of serum TSH despite they are clinically fine. So दोनों तरह के सिनेरियोज से देखें कि आपको ऐसे पेशेंट्स भी मिल रहे हैं जिसमें TSH सेटल हो गया है, क्लिनिकली सेटल नहीं है पेशेंट, या the otherwise scenario. There may be differences in bioavailability. So this is something that is nothing to worry about for now, okay? Now, there are some special considerations which are very, very important once you are considering the patient for treatment. So if you are giving the patient levothyroxine replacement, because I told you T3, T4 are in low concentration, they're not being made in the body, so you replace them exogenously. So is there any association with ischemic heart disease? So hypothyroidism and ischemic heart diseases are common conditions that often occur together. Although angina may remain unchanged in severity or paradoxically disappear with restoration of the metabolic rate, exacerbation of myocardial ischemia, infarction, and sudden death are recognized complication of levothyroxine replacement. You see, MI, sudden cardiac death, they are associated with levothyroxine therapy. और बहुत कम डोज पे भी ये साइड इफेक्ट्स रिपोर्टेड है. As low as 25 microgram patient can go into ischemic heart disease. So that's something serious to consider, okay? It has been suggested that T3 has an advantage over T4 since T3 has a shorter half-life, but that's suggestions, and levothyroxine still is used, so आपको उसके side effects पता होने चाहिए. Hypothyroidism in pregnancy. Women with hypothyroidism usually require an increased dose of levothyroxine in pregnancy. Inadequately treated hypothyroidism in pregnancy has been associated with impaired cognitive development in the fetus. So if somebody is pregnant while on therapy with levothyroxine, and things happen like this, So there was a patient जो initially say for example इसमें कोई thyroid abnormality हुई जिसकी वजह से hyperthyroidism था. There was resection of the thyroid, and now this female is hypothyroid, and you are giving levothyroxine, and she suddenly becomes pregnant. Now you have to consider the increment in the dose of levothyroxine. So you have to monitor your patients basically. Mixed edema coma. This is a very rare presentation of hypothyroidism in which there is a depressed level of consciousness. So mixed edema तो skin changes हैं, but coma इसमें decreased level of consciousness associated है, and that usually happens in elderly patients. Body temperature may be very low, and convulsions may happen. They are not uncommon. Cerebrospinal fluid pressure and protein contents are raised. The mortality is 50%. It's a very high mortality. It's a medical emergency basically, and treatment must begin before biochemical confirmation of the diagnosis. So you don't wait. If there's a patient with long-term history of hypothyroidism and the person has mixed edema and now presents with signs of coma, you start the treatment. And if you suspect any patient like this, it should be immediately treated with intravenous injections of leothyrin, followed by further injections of 2 microgram 3 times daily, unless the patient is improved. In the survivors, there is a rise in the body temperature and the patient starts coming back to normal within 24 hours basically. So you know the treatment is working or not. TSH and cortisol measurements, obviously, we sometimes also have to, because this patient is in coma, and this is an emergency situation, sometimes we have to use hydrocortisone intramuscularly at a dose of 100 milligrams 3 times daily. And obviously you must have sent by now the lab profiles, blood test आपने भेजे होंगे, तो जब तक वो नहीं आते you give a shot of hydrocortisone. So this is an emergency situation, mixed edema coma, and you have to treat it on emergency basis, right? Now, symptoms of hypothyroidism with normal thyroid function test. The classic symptom of hypothyroidism are, by their very nature, very non-specific. You see, थक रहे हैं, fatigue है, इस तरह की चीजें. There is a wide differential diagnosis जो fatigue और weight gain के अंदर आती हैं या change of mood में आती हैं. इनको देख के आप डायरेक्ट नहीं बता सकते कि this is hypothyroidism. As has been noted, outside the context of pituitary and hypothalamic disease, serum TSH is an excellent measurement for identifying the thyroid status. However, there are some individuals who are tricky, जिनके TSH concentrations normal होते हैं, but they are still hypothyroid. There are a large number of websites that claim that serum TSH is not a good measure of thyroid status, and this suggests other factors such as abnormalities of T4 to T. So these are tricky patients basically. जिनका TSH आपको ठीक मिलेगा, but वो clinically they will have hypothyroidism. So understand, this is a scenario which you may encounter in your medical practice. So that's all about hypothyroidism basically. The next video we'll talk about thyroid function test in some more detail. Okay, so take care of yourself and I'll see you in the next medical video very soon.